Welcome to the art of dissemination. Let's take the data you've collected and find the most effective way to tell everyone about your project, and find ways to sustain your success. Dissemination of evidence in nursing is the spreading of evidence-based knowledge, research, and findings by nurses to other healthcare professionals or to the general public. This increases knowledge in the nursing field, ensures the field remains up to date, and improves the quality and cost effectiveness of care. You've now completed or are nearing completion of your innovation project. So now's the time to determine exactly what are your dissemination goals. First, remind yourself of the purpose of your project. What is your project trying to achieve? Is it a policy, practice, or culture change? And how do you plan on maintaining and sustaining this project? Next, you need to specify the findings that you need to disseminate and determine who the end user is. Consider who is your target audience and how will this impact the message. Is your audience tech-savvy, visual learners, patients, staff? Consider the specifics about your audience because leaders and staff are looking for different things. Leaders often want the summary first and then the details. They'll be looking for facts and statistics that will impact their organization. They'll want to know what the value is for the organization. Will this achieve or surpass standards? Does this improve staff engagement? Is there organizational impact? Does this improve patient outcomes or client satisfaction? They'll be looking for an analysis of the costs, strong resources, and literature and research that support your project. Your team, or the organization staff, on the other hand, are looking for information that impacts them. They want to know that you understand the issues they face and how your project addressed them, and you'll need to be able to show them before and after results. You want to share information through storytelling, and the story needs to be about them. In the end, everyone wants to know what's in it for them. What are the key messages you'll share about the outcomes, and how do you plan on sustaining the work going forward? Start by considering what methods you'll use to deliver the information. Will it be via email, on a board, group sessions, workshops, presentations, newsletters, or staff meetings? And who will be responsible for sharing your outcomes? Let's start by helping you make your message impactful. As effective as your project may be, you will still need to tell people about it to put it into practice. In addition, you need to ensure that it's sustainable so that the change you have initiated continues. So now you've come up with an innovative project for your facility. Let's disseminate your results and create that engagement that will help keep up the momentum. The key to effective dissemination is to match the means of communication to the message and the needs of the audience. To adopt a method that will work for the target audience and for the type of content you have to deliver. Consolidate the results and keep them clear and graphic. There are some issues to consider when communicating your message. Think about how you can frame your research results to make them relevant to the receiver. How will you tailor your message to adapt to each end user? We want to tell everyone about our project, but not all images are created equal. The best infographics combine data, text, and visuals to tell a persuasive story. Known as the 3 Ps, posters, presentations, and papers have historically been the 3 primary ways of dissemination and remain as the most popular methods in the nursing field. This is according to Brown and Schmidt in 2009 and Dudley Brown in 2012. Infographics are graphic visual representations of information, data, or knowledge intended to represent information quickly and clearly. They can improve cognition by utilizing graphics to enhance the human visual system's ability to see patterns and trends. Let's think about the graphic elements that you may want to include in your dissemination. Choosing the right graphic will help you convey your information more clearly. For instance, a graph allows you to quickly determine if something has increased or decreased, a quick and effective way of providing information. Using the right graphic, though, can affect the impact of the message. Let's use an example to base our data and graphics on and determine the best images to use. So let's start the Huddle project. Your goal is to make your huddles more effective. You've broken down your Huddle project into 5 different test groups, and now the results are in. So the first option was a daily huddle 15 minutes before the shift began. This fresh start lets your staff get a jump on the day and hit their shift with the knowledge they need. Second option was a sit-down huddle in the middle of the day to give them a break and a little socializing and a chance to catch their breath and refocus for the second half of the day. The third option was huddles at the end of their shift, where they praised the staff they worked with and said thanks personally to each of their teams so they could leave with a positive message. The fourth option was randomized standing huddle times to keep it fresh and work around busy schedules. And the fifth option was virtual huddles by email, where you could check in at your own convenience. You've rotated through the 5 huddle schedules for 1 week at a time so that the participants had the opportunity to experience each of the 5 different timings. You then asked participants to rate the huddle's efficacy on a scale from 1 to 10, based on effectiveness, participation, joy, and information. The people at Venngage have a great tool that'll help you focus your information and produce the best image to utilize. They start by defining a single visualization goal for your chart. That goal should line up with one of their ICCOR categories. So it means your information is either going to inform, which is convey a single important message or data point that doesn't require much context to understand, or compare, show similarities or differences among values or parts of a whole, show change, visualize trends over a time or space. Does it organize, which is show groups, patterns, rank, or order? Does it reveal relationships? This is to show correlations among variables or values. Now let's look at the results and how you will best disseminate this information. Also, the Venngage information will be provided in the reference page at the end. Let's create a simple bar chart. From our responses, we were able to rate the huddles. In order, the most popular choices were a morning huddle with a score of 75, an evening huddle with a score of 72, a midday huddle with a score of 58, random huddles ranked 41, and virtual got a score of 39. So now let's look at how we would represent this information. A simple bar chart is often effective at conveying information quickly. You can see in our sample that there are a number of results reflected here. These bars represent the popularity ratings of the huddle options. They're randomly displayed, but you can see which bar is the longest, so therefore the most popular. If we again use that ICCOR, the inform, compare, show change, organize, or reveal relationships criteria, we can determine that to compare information, a bar chart is most effective. But wait, what is a Pareto chart, and is it the more effective choice? So what is a Pareto chart and how would I create one? A Pareto chart is a simple but even more effective bar graph. The lengths of the bars can represent frequency or cost or time or money, in this case, votes, and are usually arranged with the longest bars on the left and the shortest to the right. In this way, the chart visually depicts which situations are more significant. It finishes with a line arc to include all the data collected. This would be an effective way to arrange the 5 different huddle options in order of their popularity. You would very quickly determine what the preferred huddle option was. I've included an Excel tutorial on the reference page as well to help you with your first Pareto chart. Maybe a pie chart will create a clearer picture of your results. Pie charts are great when you need to convey percentages. In this case, the pie chart is probably not the best choice to quickly convey the results of our initial data. But let's say we wanted to additionally break down our participants into age groups. Then you can see how a pie chart will be an effective infographic to use. Again, on the reference page, I've included a link on how you can create your own pie chart. If you're looking for a more creative interpretation of your results, a PowerPoint presentation is another great tool to keep your information visual and simplify your message to make it impactful. You can find a number of templates that will turn your data into images in PowerPoint. I'll provide you with some PowerPoint templates in the reference page again. Now let's measure your dissemination success. How will you know if you've met your dissemination goals? What is your success criteria? Are there measurable indicators? For example, the number of nurses reached, the number of website hits, the number of inquiries received. How will you involve end users in evaluating the dissemination activities so that you can measure your success? For example, maybe you can obtain feedback on how the project impacted them. Going forward, you'll need to consider how you'll keep in contact with users and potential users. How will you incorporate their feedback in your future research, product design, and ongoing development to sustain the project in the future? Part of your dissemination work plan should be to include immediate action items, scheduling, communication avenues, and persons responsible. The final goal of these amazing innovation projects should be to ensure their sustainability for years to come, so that the benefits reach as many people as possible. Let's keep that momentum going. As we are disseminating the information from our projects, we need to keep in mind their sustainability. Part of that will be collecting results and continuing to have communication with the partners and people involved. Consider what measurements of success you will have worked into the project and how to further disseminate information so that you are receiving the feedback you need to maintain its impact. After disseminating your information, your priority now should be in finding a way to measure your project's sustainability. While disseminating and gathering information, you'll be collecting feedback data and compiling evidence-supported results about the value of continued sustainability, along with research and strategies to ensure success. Disseminating your information sends the data out to the participants, but don't forget to use that opportunity to gather and measure responses so that you may advance your sustainability research, enhance the culture, and fine-tune your project to ensure its continued acceptance, utilization, and success for years to come.